It looks like we'll begin to the presentation. Looks like we've got several people joined us now. I'm Brian Labaugh, Deputy Superintendent, and I'm thankful you could join us today. Just as you just heard, we're recording this presentation so that we can post to the district's YouTube channel. Next. Our agenda is to talk a little bit about safety protocols, academics, where we're at with that, social, emotional, and mental health, and provide some Q&A, questions and answers. Our overall success so far and to the future with managing COVID will be measured on the ability of everyone doing their part in wearing well-fitting masks, washing hands, maintaining social distancing, following the instructions of staff members, and staying home when sick. We're all in this together. Tonight's webinar, please use the Q&A function to ask your questions. All participants will be on mute. We'll stop occasionally to answer questions, and some will be answered in the Q&A box. At the end of the webinar, we'll also answer those questions we can. This webinar is for 1 hour. The webinar video will be posted to the district's YouTube channel and linked to the website. The major part of our school safety plans has been minimizing exposure. So we've used money from the federal government called the Elementary and Secondary School Emergency Relief Fund to support following safety measures and testing. Students and staff follow our safety plans. We have additional cleaning protocols at schools and on our buses, including assigned seating. We have done HVAC upgrades and changed filters often in our buildings. We've provided masks. We've increased social distancing in the classroom. All of our staff wear required PPE. We have provided students cloth masks, and when they don't have masks, when they arrive at the bus or arrive at school, we provide them to them. We ask everyone to follow the protocols in case of a positive COVID-19 case occurs and students being exposed to a positive COVID-19 individual. And we do have a rapid testing center here for quarantine staff and students to allow for faster return to in-person learning. We have expanded our testing center hours at Harry E. Lang Stadium from 10 a.m. to 5 p.m. Monday through Friday. The testing center may close to availability of test kits or to high volume. Locally, new testing center has opened for a temporary basis to the public in DuPont in the parking lot of the State Farm Insurance Building. In addition to what I mentioned in the school safety plans before, we've increased daily cleaning and disinfecting of high traffic areas, doors, countersinks, and other horizontal surfaces. We've created safe hygiene and hand washing signs throughout the schools. We have additional signage reminding students to wear masks. We purchased UV sanitizers to clean highly impacted areas in a building, and we increased that frequency of changing ventilation filters, as well as increasing the air exchange to maximize outside air. Our district safety plan was designed to protect the health and safety of all our state staff and students. Plan objectives are aligned with the recommendations from the Office of Superintendent of Public Instruction and the Washington State and Pierce County Health Departments. The Omicron variant has increased the number of COVID-19 cases amongst staff and students. We hope to see the peak, get over the peak and start on the downside of that soon. They say 2 to 4 weeks. We plan to continue providing in-person learning as we focus on what it takes to keep schools open. We may be, and we have been, prepared to temporarily close classrooms or schools if needed and shift to virtual learning due to an overwhelming number of COVID-19 or other illnesses or ongoing staffing shortages in general and due to COVID-19. Staff are maintaining and updating Teams classrooms for the possibility of a classroom or school closure. Students will work from their school provided laptops if this were to happen. State Office of Public Instruction requires that when a classroom or school is closed, that remote instruction must be live for at least 70% of the instructional day. Your school administrator will share the schedule for the day should a closure happen. It's important that students have their devices and internet service. Next. As I've said before, all school personnel, volunteers, visitors, and students must wear well-fitting face coverings or acceptable alternative at school, indoors, in accordance with the governor's statewide mask order that was done in August of 2021. Students and staff are providing masks when they don't have one, and either on the bus or arriving at school for students, and staff wear the masks that are provided by their building COVID manager. Next. We have maintained full-time in-person learning aligned with the K-12 Department of Health guidance and Governor Inslee's orders. Schools are still following their standard 5-day school schedules and aligned with our district's school year calendar. We did make a virtual option available for families in grades K-12 through state-approved alternative learning education providers. We use Pearson. For our K-5 students, right now we have approximately 180 students in that program, and Graduation Alliance for our middle school and high school students, where we have about 321 students. A virtual school option was made available at the start of the school year. This was not required by the state. As another way of serving students, we opted to provide an online option for our families. We're examining offering virtual school again for the fall of 2022, in addition to full-time in-person learning. Stay tuned for more information regarding the 22-23 school year. Next. We continue to provide one-to-one technology for our students, continuing to use Teams for assignments and classes. We have started last year a free online 24/7 tutoring system for middle and high school students called Paper. You can learn more about Paper from our district website or your school. And we have administered state assessments this past fall, and we'll be doing state assessments this coming spring. We have provided provided district laptops to all of our students to bring back and forth home to school, as well as internet connections. If you need a hotspot to provide internet at your home, please contact your school principal. The hotspots are provided free of charge for a school year. Secondary students have free access to the 24/7 online tutoring through Paper. The tutoring service helps with math, writing, science, and social studies. Students in grades 3 through 8 and grades 10 through 11 will be taking state assessments starting in April. School-specific schedules will be shared by the school principal. Next. As I've mentioned before, classroom teachers continue to use Microsoft Teams. They upload and maintain daily classwork and activities, homework, lesson plans, and other instructional materials in Teams. And we use Microsoft Outlook or Teams when communicating with students via email. Next. So now we're going to talk a little bit about COVID-19 protocols. So isolation and quarantine, these are two words you hear quite often. An individual is directed to isolate if they are diagnosed with COVID-19. That is, they're positive with COVID-19. Quarantine is when an individual will be directed to stay home because they've been exposed or identified as a close contact to an individual with COVID-19 that has happened at school or at home or in the community within the last 14 days. Next. On January 7th, the Department of Health updated its K-12 guidance, and they changed, Department of Health updated the guidance around isolation. So students who test positive for COVID-19 must isolate at home for at least 5 full days, regardless of their vaccination status. The student may return to school when all of the following criteria are met. 5 days from the symptom onset or positive test sample was collected. They have no symptoms or their symptoms are improving, and they have no fever without the use of any fever-reducing medications within the past 24 hours. Students and staff should continue to monitor for symptoms and wear a well-fitting mask around others through day 10, days 6 through 10, both in and out of school, including during extracurricular and sports activities. Individuals who have been in isolation may test on day 5 of their isolation period, but it is not required, but only if the above criteria for completing isolation have been met. An antigen test is recommended. If the test result is positive, they must continue to isolate until day 10. If the test result is negative, they may return to school or work. Again, testing is optional. Again, to return after isolation, you need to do the 5 full days. Make sure that you have no symptoms or the symptoms have greatly improved and there is no fever without the use of fever-reducing medications. Next. So there were also changes in the length of quarantine. The length of quarantine was updated on January 7th as well by the Department of Health in the K-12 guidance. To return from a shortened quarantine, a student must have a lab verified negative COVID-19 test result. Day exposure counts as day 0. The first day of quarantine begins the day after exposure to the positive COVID-19 individual. There is a chart on our district webpage giving examples of quarantine return dates. For extended quarantine timelines, where a student is exposed to a family member at home who is ill with COVID, families will work with the school nurse to establish a return date. So again, there are some people who may be identified as a close contact, but they don't have to quarantine if they are fully vaccinated and do not have symptoms. And they're still encouraged to get a test 5 to 7 days after exposure, or they had tested positive for COVID-19 in the last 90 days and don't have any other symptoms. To follow the shortened quarantine, unvaccinated close contacts can shorten the quarantine if they receive a lab verified negative COVID-19 test no sooner than day 5 after exposure. Unvaccinated close contacts must complete the full 10 days of quarantine if they do not have a lab verified negative COVID-19 test. Next. So you might ask, who is not a close contact? Also in the January 7th update of the K-12 Department of Health guidance, they updated who is not a close contact. So in a K-12 indoor or outdoor classroom or other structured environment with assigned seating, the close definition excludes students and staff who are at least 3 feet away from an infected individual when both were wearing appropriately fitting face coverings or masks, and other prevention strategies like our ventilation, filter changing, those things are in place. So that is the basic definition of who is not a close contact. Next. So who must quarantine? Students who are identified as close contacts with someone with COVID-19 quarantine for at least 5 days, day 0 through day 5. Now, if they are in one of the following groups, they do have to quarantine. Anybody over the age of 18 who has only completed their primary series of the vaccine, but have not yet received their recommended booster shot when eligible. And the same is true for somebody who has the Johnson & Johnson vaccine and have not yet received the recommended booster shot. And those who are not vaccinated, they're unvaccinated or have not completed a primary vaccine series like Moderna or Pfizer. For household exposures, this would be the last day the person with COVID-19 is considered infectious, and the opposite would be when they have become healthy again. The eligibility for the Moderna Pfizer boosters is after 5 months from the second dose, and you notice in the slide Johnson & Johnson is 2 months after the one shot. For the majority of students, they are in the process of completing their 2-dose primary vaccine. District contact tracers and building COVID managers work with families on who must quarantine in the case of an exposure. Next. So who does not need to quarantine? Up on that slide where we said who is not a close contact, those people don't have to. So in general, if you're in a classroom wearing a mask, staying 3 feet or more away from others, you don't have to quarantine. Students and staff who have been notified as close contact, so if they've broken that distance or it's at lunchtime or riding a bus, do not need to quarantine if they are 18 and older and have received their booster and are symptom-free, or they're between the ages of 5 and 17 and they've completed their primary series of the COVID-19 vaccine and are symptom-free, or had confirmed COVID-19 within the last 90 days. The majority of our staff members are eligible for the booster and mostly have completed their series with the booster. It is not mandatory that staff receive a booster. The students who have not, students who have completed their primary vaccine series are not yet, sorry, I'll start that all over again. Students who have completed their primary vaccine series are not yet eligible for the booster. Next, just an example here of the length of a quarantine. So the day, we consider day 0 the day of exposure, and then the quarantine is days 1 through 5. You would get tested on day 5, and as long as no symptoms have developed, and then you get a COVID test on day 6. You can return to school with a negative test that is documented. So for example, if you're exposed on Monday, that's day 0. Quarantine is Tuesday through Saturday. If you're able to test on Saturday or later, you can return to work to school on Monday. We did have an update this week. There is some conflicting guidance between students in preschool and students in childcare. One of the issues we have is the guidance, and I've said this a couple times now, from Department of Health, covers K-12, but does not cover preschool or childcare. That is a different agency, and they have a different quarantine period for students ages 3 to almost, ongoing 5, than what we have for students who are in elementary school K-5 and above. So under the current childcare and preschool guidance, there is a ability to have a shortened quarantine, what we call a modified quarantine, where you test on day 5, 6, or 7 of quarantine. If you receive a negative test, you can return on day 8. If you do not do the testing, you quarantine for a full 10 days after exposure to a positive individual. It's a little bit nuanced from that of a kindergartner. I mentioned earlier that we do free COVID rapid testing for quarantine staff and students. Our testing center is open Monday through Friday. We did expand it to 10 to 5 recently. It's at our football stadium, Harry E. Lang Stadium, at the ticket booth, 6015 111th Street Southwest in Lakewood. Remember, at quarantine, you can test on day 5 of the quarantine or after, and return if you have a negative COVID-19 test and improving or no symptoms at all, and no fever without the aid of medication. I do want to point out, just like all testing centers, our lines are long, and sometimes due to the high number of individuals being tested, the test center may close early to process those tests and get those test results out, as well as making sure there are enough test kits available to test the people in line. Next, we did get new guidance over last night. This is actually brand new information The Department of Health in their K-12 guidance came out with a change to our testing of athletes in high contact sports. So right now, what are considered high contact sports are boys and girls basketball and boys and girls wrestling. That we're in that current season. We have been testing those athletes 3 times a week. We are no longer required to do that. They are saying to test only on the day of competition, and then anybody who shows up positive on the day of competition is excluded. To do that, we need to ensure that universal masking of all athletes occurs during all practices and training for these high-risk sports. During competition, athletes do not need to wear their masks. We were as well testing all coaches, trainers, and staff 3 times a week. We are not required to do that anymore, but coaches, trainers, and staff must wear their masks in all practices, training, and during competitions. This is a change from previous policy around high-risk athletics or high-contact athletics like basketball and wrestling. Next. We do continue to provide additional social, emotional, and mental health support. We use some of our ESSER funding for this expanded support. It also helped with making sure there was K-12 social emotional learning curriculum. We use Second Step K-8, and we use Character Strong 9-12. We also continue with our engagement teams to work to support struggling students and connect them to the additional resources. We expanded our partnerships with Greater Lakes Mental Health. We have partnered with the Stephen A. Cohen Valley Cities Clinic, JBLM, Joint Base Lewis McCord, and other partners to connect students to counseling and resources. And we're currently working on an additional partnership with the City of Lakewood for additional mental health, for an additional mental health resource coordinator. We have also expanded our partnership with the YMCA and run programs at Hutloff, Lockburn, and Thomas Middle Schools. Please see your principal about what supports are at your school. Next. In transportation, of course, our goal is to continue serving all bus routes. We use all available licensed bus drivers to transport students to and from school. As many of you are aware, we adjusted our school start times this fall to address driver shortages, which in turn really reduced the number of routes that we run throughout the district. But due to illness, shortages of actual licensed bus drivers, we've had to do some double or triple runs to serve all of our students. It continues to be an ongoing concern. We're always looking for additional bus drivers, and there are bonuses if people sign up to be bus drivers. Please see our career page on the district webpage. Next. So we also know we have been doing so far with our student nutrition. When students are at school, we have been providing free access to breakfast and lunch. And our students who have been attending in virtual learning have been able to come to school and pick up a lunch and a breakfast. We do know that when parents and when students are isolated or quarantined, it's a little bit hard, and it has been hard to get your meals. This is new. We're going to start this next week on Wednesday, February 2nd, that parents of students who are isolated or quarantined may pick up 2 days worth of meals from their students' schools. So the window to pick up the meals will be 1 hour after the last lunch service. And then parents would pick up meals every other day. So it'd be Monday, Wednesday, Tuesday, Thursday. Our waiver allows family members to pick up the lunches and or breakfasts for quarantined or isolated students. How the school distributes the lunches to family members will be site specific. Nutrition will need a daily accounting of who picked up the lunches and breakfasts. You'll be notified by your school on how to access the program. We'll be able to start this on Wednesday, February 2nd, and we'll monitor and take feedback on the process. that is the final slide. And now we're to questions. You can post questions.
Okay, I do have one. Thank you so much. This is from Liz Spencer. What about a preschooler that is fully vaccinated? Do they still have to quarantine and test before returning to school, even if they are not symptomatic?
Yeah, there are some preschoolers who are age 5, right? So that they were able to get vaccinated. I would work with the Jennifer White or Tana Scarborough, who are the staff at the Early Learning Center. They can give you good guidance.
And I have another one. When a student has to quarantine because of direct exposure multiple times in a month, what is the district doing to ensure these students are getting the instruction they should be getting? And how does this affect truancy laws?
So when students are out for quarantine, we mark students excused absent. So we do know for the period of time that they're out, so they are not considered to be unexcused. We automatically excuse the absence. We continue to work with our teachers, and there are several teachers that are very, very good at this, about posting daily classwork and lessons, activities, homework in their Microsoft Teams platforms. And that's a good place to access all that daily work to keep up with class while you're quarantined. Some schools, depending on what the age of the student is and what their needs are, have provided packets as well for students. That primarily happens at preschool or the early grades in elementary, so that the student can keep up with their daily work. A lot of our lessons are like math is an online program called Zern, where students access that through their laptop or their device. We also have a intervention program called Freckle that students can get through their device as well at elementary. And then a majority of our instructional materials are online as well, and students can access those as well through their district provided device.
A question is from the Keller family. Is the district still doing contact tracing, specifically on the bus and in sports?
We are still contact tracing on the bus, at lunch, and in athletics.
All right, this is a great question. What is the, not that they're not all great questions, sorry about that. They're all good questions.
This is the greatest
trust
question
me.
there is. Yes.
Otherwise, why would we be asking? So what is the threshold for moving to temporary remote learning for a classroom or a building? For example, is it a 30% absenteeism? Is it higher?
No, we have not set ourselves up for any number. We've worked closely with the Tacoma-Pierce County Health Department, and we look for their guidance, right? So they help us out with that decision. We've had to periodically basically go to remote instruction for a classroom because the number of students has been quite high on either quarantine and COVID, the combination of the two. Our real effort is to keep school open, keep students coming to school, because we know that's where they learn best, and focus on making sure that happens every day and every week. But we do know from time to time, we're going to have to potentially close down a classroom, and we move to that remote instruction that I talked about before. One challenge about remote instruction is that you got to do 70% of your school day in live instruction online. And so why we still could focus on in-person instruction is that that's a long day to be online, right? So you take your 6-hour school day, you multiply that times 0.7, and you're looking at a 4.5-hour day roughly spent viewing your computer in order for us to maintain funding from the state.
So a great point, and you just made that point actually, but Teams is not actual teaching. So if a student is home and they're getting their assignments on Teams, it's not live teaching. Is there a way to provide virtual lessons where students can tap into the classroom where they can get that instruction? It's a question. It's not just me asking that, Brian. Just thought I'd.
Oh, right. Who's asking that question? No, not at this time. We are not able to do what that would be called simultaneous instruction, where the classroom teacher is actually teaching students in person, and then at the same time teaching students via Teams, right, or online, or what we sometimes call synchronous instruction. The combination of those two is called simultaneous instruction.
Hey, sorry, trying to unmute. Are you verifying that, again, a question from our audience, are you verifying that the COVID tests submitted to return to school are in fact lab tests and not necessarily home tests? And how do you verify that?
So if you go to our testing center here at Harry Lang, they text you back your results, or they email your results back to you, so we can easily you can easily show that on the phone, or show that when you drop your student off at school, or they can show it on their phone, or you can email to the school that the results are negative. Most testing centers, even the temporary one that'll be over in DuPont, do results by phone or by email.
Okay, so we are asking our families to go to our testing site where that at Harry Lang for that test.
For that test.
To return.
Or I believe JBLM's testing center does the same thing. You get your results by phone or email.
Okay, as opposed to a home test.
Opposed to a home test.
Got it. Next question, are teachers and staff vaccinated?
A good portion of our staff are fully vaccinated. In the governor's orders for school staff to be vaccinated, there was provision for staff to get exemption, and we have some staff who are exempted from the vaccine, and they undergo weekly testing and daily wellness attestation to the district, so we monitor their health very closely. Students are not required to be vaccinated. They are eligible to be vaccinated, but as of yet, not required by the state of Washington. If you go, where did I see that link? We could probably provide that to you. The state of Washington is looking for feedback from the residents of Washington state on whether or not to require a vaccine. The COVID-19 vaccine is part of the vaccines that they do require for in-person public education, but that is not currently required. They're looking at that.
Okay, another question. When should families expect to be notified of a positive case in their student's school? Will we be notified of any case in the building, bus, sports team, or only if our child is deemed a close contact?
At this point, due to the high volume, only if your student is deemed a close contact will you be notified.
Just a clarification, the question was, is the district accepting home tests to return to school? We didn't make that clear enough. Is it a home test or is it a lab test required to return to school?
So there are two different places where you can test. So you can test if you've been required to isolate, which is when you've already tested positive for COVID-19 and you're out of school for 5 days. There is no requirement after isolation to get a test to return to school, as long as you're feeling healthy and you have no fever after 24 hours without the use of a fever-reducing medication. However, there is a should, could, may option if you feel that you do need to get tested. We don't need to see those results as long as your student is feeling healthy enough to come to school after the 5 days of isolation and the student's feeling well, then they can come back to school. The only place where a test is required is during after quarantine. And so when you quarantine for 5 full days, you do need to come back with a lab verified COVID-19 test result. And our testing center provides that to you either through text or email. JBLM, of course, does that, and any of the Tacoma Pierce County Health Department testing centers do that, but we do not take home COVID tests for return from quarantine. It's not really our decision, that is the guidance from Department of Health, the K-12 guidance, and that's their requirement to be out for only 5 days. That's really a short, and remember the old quarantine was a full 10 days, and early on before the vaccine was around, that was 14 days. So we've gone from 14 to 10 and now to 5. So 5 and test, or you can stay out 10 days and not get a test.
The question, we may need more clarification on the question. So the question goes, my 8-year-old was fully vaccinated by the first week of December, but how do I get this QR code in case they need a test?
So when you come to our testing center, there are signs along the fence that leads up to the test site that have the QR code on them, and all you have to do is take your phone and do the QR code. We also have handouts that are sent out or can be picked up at your school that have the QR code on them.
Thank you. Great. Next question. Would the district consider a synchronized teaching?
Or simultaneous instruction?
Yes, simultaneous. Well, yes, I'm just reading the question.
Synchronized dancing,
yes,
or
yes.
Swimming. No, not at this juncture. We're not ready for that just yet.
All right. I don't have any more questions on the Q&A. I'm jumping over to the chat. Just to let you know, we have put some things in the chat. There are some links that are from the Washington State Department of Health that is has a link to that you can order at-home test kits. They're limited to 5 per family. Realize that the supplies are probably wiped out right now, but they're going to restock. So you're just going to have to keep on trying. But that link is in there. The link to the Tacoma-Pierce County Health Department is also in there. I think there was another link that just to let people know that is also in there. And there was a federal government test site, www.covidtest.gov, also in there. So if you didn't get those or write those down, I just wanted to call your attention to that. I'm going to jump back over and see if anything else. I'm sorry, Rochelle, could you ask your question? Could you type in your question again? It says my initial question wasn't answered. I may have missed that, and I do apologize. I'm going to scroll through and see if I see your name, or you may have been in the chat and then it didn't get answered live. It was the first one.
Oh, I see it.
Oh, did you?
She's having little confidence in the ability to minimize my children's exposure. What options do I have? I'm also curious why we haven't gone to a hybrid schedule, which minimizes potential contact, especially if staffing is an issue. Doesn't seem the best for the staff or the children. Oh, and then, and I was her teacher 20 years ago. That's what happens when you stay one place a long time, right? So yes, the state hasn't given us the option to do hybrid, right? So they're requiring us to be full-time in-person instruction in order to get full funding for instruction. We did offer a K-12 virtual option this fall. We did have some elementary students enter into the program during the month of January. It's still open, actually, if you wanted to move over to the virtual option. It only have a couple days left. But we weren't required to do that, but we knew that there were individuals who felt that that was the best option for their children. We felt that was the best thing to serve our families in the school district. So we have run this K-12 virtual program. It is for K-5 an interesting process because it's a lot of asynchronous work. There's not much live instruction in our K-5 platform. So just know that going into it. The middle schoolers and high schoolers that we have in our program appreciate the fact that there's not a lot of live instruction, and we see the dichotomy there between the two groups. The elementary families prefer a little bit more direct live instruction, and our platform does not do that. But right now, the state doesn't allow us to do hybrid. We have to do full-time in-person instruction. But that was why we created the K-12 virtual option, was so to give people that opportunity.
From the Keller family, is the district providing case numbers from schools in an effort to be transparent as some other neighboring districts are doing on their websites?
Yes, so it's under our return. If you get to our district website and you look for return to learning, there's a on the main page there is a piece that says return to learning, and if you go to and you keep navigating to health and safety, you are, I think, return to learning. Oh, there's someone getting us there. And you get to health and safety. Where is it? Oh yes, it's the, I always forget which one it is. Right there at the COVID-19 protocols. If you click on COVID-19 protocols, you'll see the chart that talks about, we update this once a week. It's always about the week prior. So we update these on Tuesdays using the data from the prior week. You can see where the number of confirmed positive COVID cases come from at each of the schools. So we do show that. It's up there. So next Tuesday, there'll be an update from this week.
See, we learn something all the time. It's sometimes just navigating and finding that. So if you ever have issues with that, please let us know and we'll get you there. There was a comment made about that a lot of these decisions are up to the state, and and the comment, we just want to get through this. And I will say, oh my gosh, so do we want to get through this. But again, you have choices if this isn't working for you, and I do understand that. So let us help us. We can certainly help you in our student services department if you need to navigate your choices. So I will send that to you. Also, thank you for the visualization. So I think that was Ben Miller in our community relations department giving us the visual of where to find it. Sometimes that's hard. I'm going to jump back over and see if anything is under the chat. A comment was made that you had made something about the K-5 program is, and her comment was, it's more like homeschooling.
Yes, and
then, yeah,
that's a very accurate description of it, right? It's not, and we're not fully funded for it either, right? So it goes under what's called alternative learning experience funding, because it is not 70% live instruction daily.
All right, well, I don't see any other questions that we haven't answered. I'm sure there's other questions people may have, but if we limit this just to the COVID and vaccinations and testing and test sites, and we all kind of joked that tomorrow there may be another change. So bear with us. It's not that we're holding anything back. We're just trying to keep up with the many, 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 many changes.
Right.
And so this was from somebody. It says, thank you for the information, stay healthy. So yes, that is the best advice of all, is to stay healthy.
Yes, and there's more information on our on our district website too. So if you navigate to that return to learning, there's a lot of different pieces there. There's also a chart around the isolation quarantine changes, and you can look at, like, my student was positive on this day, when would I expect them to be back in school? So there's that'll be updated for the month of February. So
I also think this is another update, and their question just came in through the chat. Are children required to wear a face mask outside on recess when keeping social distance?
I know I saw that question. We might have to get back to them. There is no requirement outside as long as students are maintaining appropriate social distancing. They may be on a playground equipment, not able to maintain appropriate social distance. So if you're just playing on the playground, just playing, but if you're up on the equipment, you do probably would be wearing your mask because it's hard to stay 3 feet apart if you're on the playground devices.
And although it's a good measuring tactic, I don't know how many kindergartners know exactly the 3 feet,
Yeah,
right?
right.
It's like we're all learning, right?
Yes.
But although I have to say our children are doing an amazing job.
Yes,
So parents,
yes.
great job. They really are doing a better job than I think some adults are. So our kids are doing great. So that's all. Thank you for that.
I was at Palmer Park High School yesterday. And I was just impressed by how the students were wearing their masks.
Yeah, I agree with you. All right. This is like an auction. It's going, gone, and then we will have no more. We can't answer your questions live. So if you have anything that you'd like to ask, you can either put it in the chat or you can put it in the Q&A. I'm getting pretty good at this, jumping back and forth. As long as I don't have to answer the questions and I have somebody else doing that, it's a lot easier. But it looks like we've got it. So thank you to all of our families who've joined in some really wonderful questions. I'm glad that you participated. Every time we think we know it, it changes, right? Oh, wait, well, there might have been one more. Wait. Oh, we got a thank you. We'll take thank you. We'll take thank you.
We will.
Yes.
We will.
Yes. And another thank you for the information. So we do appreciate that. One last one. Thank you for keeping our kids and staff safe. So from an anonymous attendee, whomever you are, we thank you for that as well.
Yes.
So I guess that goes for everyone. Do keep yourself safe and well, I think. Oh, will the schools, here's one more. There's always one more, right? I didn't say going. I didn't say the last word of God, right? I didn't say it. So it's fair game. Will the schools provide N95 masks for students?
When a student doesn't have a mask or needs a mask, we have been providing them the 3-ply surgical face masks when they come to school or get on the school bus. They're certainly welcome to get those every day when they show up at school. Our staff wear the KN95 mask, but we haven't been providing the N95 mask to anyone.
All right. I hope that answers your question. And now it truly is going, gone. Thank you all again for attending. I hope you have a wonderful rest of your evening and do stay safe.
Thank you. Good night.
Good night.